Health and Human Services Secretary Alex Azar testifying this morning before the Senate Finance Committee. Healthcare still a hot-button issue heading into the 2018 midterms as people look for cheaper alternatives to those pricey plans. One growing alternative to a traditional insurance plan is called Healthcare Sharing Ministries. Total plans expected to top $1 billion in annual medical billing this year, with more than 1 million people now belonging to such plans. So what are they all about? Well, I'll tell you. Joining us now exclusively is the president of the Alliance of Healthcare Sharing Ministries. He's former Republican congressman from Florida and doctor. He's very accomplished, Dave Weldon. Dr. Weldon, thanks for joining us. Explain to me, if you can, in a nutshell, how these insurance plans work.
They are not insurance plans. They are Christian ministries, and they're registered with the government as charitable institutions, and they engage in sharing of healthcare costs. So if you're a member and you get sick, you let the ministry know, and they ask other members in the ministry to contribute to cover your medical bills. That's basically how they work, but it's not insurance.
Gotcha. So there's no guarantee that your medical bills will be paid?
Correct. There's no contract, but they have an excellent, they've been around for 30 years. They have an excellent track record of paying their bills, and they pay some very, very significant bills. Some of these ministries, you can go on their website and you can actually see testimonials of people with six-figure bills that have been paid, serious illnesses that have been covered. So there's hundreds of thousands of people doing this.
Right.
So when you have hundreds of thousands of people contributing into it, you can pay big bills.
That's
so it works.
True. So, but what about pre-existing conditions? Can you be rejected because of those?
Well, they have the ability to do that. They're not, they don't come under the ACA, but most of them, they will put a time limit on your pre-existing. Now, you have to remember, pre-existing illness exclusions are there to protect the people who pay their premium every month from the people who wait till they get sick to come into the plan. And I think these ministries solve that problem the best way, which is a waiting period. So if you join the ministry, they may not cover your pre-existing heart condition for a year or 2 years, but then they eventually cover it. And if you go to their website, you will see lots of testimonials of people who had pre-existing illnesses that were ultimately covered by the plans.
Now, you mentioned premiums. I know that they differ from ministry to ministry or plan to plan, but what kind of premiums are you looking at? What kind of deductibles?
Well, they don't call them premiums. They call them your share amount, because it's not insurance. And they usually have something called a family share amount, which is basically what you're responsible until the plan kicks in. But they vary from as low as $175 for a single individual who's healthy to $400, $500, $600 a month for somebody with a family plan and older.
And that's a lot cheaper than any ObamaCare plan, from what I can see. The ACA Silver plan has, deductible $4,000. You pay $743 a month. I mean, there are certainly limitations, but is this an affordable alternative? And who does it really work for?
Well, these are Christian ministries, so most of them are Christian. Some of them will accept non-Christians. The 3 ministries in the Alliance are Christian ministries, so you have to be a Christian to join. One of the ministries asks for a letter of testimonial from your pastor that you're a member of the church. But you just touched on an issue that's very, very interesting. If you look at who is enrolled in these ministries, or who has joined these ministries, a lot of these people are of limited means. About 75% of them, or close to 75% of them, are at or below 400% of the poverty level. I think about 40% or 200% of the poverty level. So these are not people with a lot of money, and they're people who generally are being hurt badly by the ACA.
Very interesting,
and they're turning to this.
I don't want to cut you off, but your satellite time is about to disappear, and I'm going to want to say thank you before that happens. Dr. Dave Weldon, thank you for joining us. We appreciate it.
Ashley, it's great to be on with you, Ashley. God bless.
Really appreciate
Bye-bye.
it. Same to you, sir. Thank you very much.